Instruments. M2 is a new rotary night-eye system with instruments in tapers 04, 05, 06 and 07. The instruments are flexible and have very efficient cutting edges. This makes the shaping procedure and therefore three-dimensional cleaning of the root canal easy. Design characteristics. 2 blades and a non-cutting tip. The back of the blade is sharp to optimize cutting efficiency and facilitate advancement of the instrument in the canal. Maximum space for removal of dentin and minimum radial contact. The core width is designed for maximum flexibility without compromising the instrument's strength. M2 is very efficient. It advances automatically in the canal without any pressure. Unlike other instruments with active cutting edges, the natural advancement in the root canal is gentle, controlled, and without an undesired screw-in effect. Efficient dentinal debris removal and minimal radial friction reduces resistance and enables good instrument control. M2's blades are long spirals, almost vertical, ensuring better control of instrument progression. The distance between the blades increases from the tip of the file towards the shaft. The pitch is progressive and the space for dentin removal is deeper at the back of the blade, helping to reduce blockage and the accumulation of dentin chips. This increases safety of use. The progressive pitch allows the instrument to proceed towards the apical area safely whilst working more efficiently in the coronal third. In the proposed sequence, the instrument always reaches the apex to achieve a continuous taper along the whole canal, but it can also work at different levels within the canal due to a lateral cutting ability. This allows the coronal portions of the canal to be widened, thus softening the curvature. The 11 mm shaft is much shorter than that of most instruments and enables easier access to molars. M2 has radiograph visible depth markings and silicone stoppers. The different tapers are easily distinguishable by the number of rings on the shaft. M2 taper 04 with 1 ring, M2 taper 05 with 2 rings, M2 taper 06 with 3 rings, M2 taper 07 with 4 rings. Material. M2 is made of a highly elastic nickel-titanium alloy. The main advantages of night-eye are a shape memory effect, treated at approximately 600 degrees centigrade, high flexibility, respect of canal morphology, high fracture resistance, optimal resistance to corrosion. Taper. Traditional instruments have an O2 or 2% taper, that is, they increase 0.2 mm in diameter every 1 mm along the length of the instrument. The introduction of night-eye in endodontic instruments made instruments with larger tapers possible and allowed us to take advantage of the highly elastic night-eye alloy. The advantages of using instruments of different tapers are substantial. Fast and early elimination of coronal interferences and direct and easy access to the apical third. Faster and more effective preparation, often possible with just a few instruments. Canal shaping, also suitable for the latest obturation methods, using less instruments and without the use of Gates-Glidden drills. Increased space for efficient irrigation of the root canal. Unique. M2 is the only night-eye system with 1004 and 1505 instruments, that is, an instrument with an ISO size 10 tip and an 04 taper, and an instrument with an ISO size 15 tip and an 05 taper. These two instruments, used at the beginning of the preparation, are very effective in shaping the canal and reaching the apical third. M2's high cutting efficiency enables the whole length of the root canal to be cleaned and shaped using a method of alternating natural progression and passive filing. Thanks to M2's larger taper and progressive pitch, the apical third can be reached rapidly and safely, whilst the coronal and middle thirds can be efficiently cleaned using circumferential filing if the diameter of the root canal is greater than that of the M2 instrument. M2 instruments in working lengths 25 and 31 mm are the only endodontic instruments available which have both a 16 mm and a 21 mm working part. If there are interferences in the pulp chamber, the 21 mm working part instruments can be used to eliminate these gradually and automatically with a filing motion without weakening the tooth.